Can you have iron deficiency symptoms without anemia? That includes any of the following: fatigue, weakness, shortness of breath, dizziness, palpitations, rapid heart rate, ringing or whooshing sound in ears, lack of focus and concentration, anxiety, depression, irritability, headaches, cold intolerance, hair loss, and more can be caused by iron deficiency, even though your doctor says you're fine and you don't have anemia. So I'm going to show you how to figure that out and what to do about it. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. I've been blessed to have seen over 100,000 patient visits over the last 39 years, many of whom have gut and thyroid issues, and abnormal ferritin levels are a common thing I see. And a recent patient was one example. A 19-year-old woman came in with fatigue, anxiety, dizziness, headaches, increased heart rate. She had abdominal pain, bloating, diarrhea, bloody stools, as she was diagnosed with ulcerative colitis. Some of the results her labs indicated was very low iron and iron saturation, but she did not have anemia, low hemoglobin, or red blood cells. So the first thing you want to do is get the proper testing, and the minimum to determine your iron status would be, besides the usual CBC, comprehensive metabolic panel, lipids, and TSH, which is what your doctor usually runs, you want to also get ferritin, serum iron saturation, TIBC, CRP, LDH, GGT, insulin, A1C, uric acid. Now, don't just ask for ferritin, which represents your stored iron levels, because it also represents inflammation and other things. So, for instance, this patient had low iron and saturation and normal ferritin. And the reason her ferritin was normal was because she had high white blood count and neutrophils indicating an infection and high inflammation in her gut. So that raised her ferritin while the iron deficiency lowered it, thus giving her a normal ferritin. So if all you checked was the CBC and ferritin, her iron deficiency would have been completely missed. Now, her GI doctor wanted her to do an iron infusion. So is that necessary? Well, if you have severe anemia, which she didn't, or are unable to take oral supplements, then that can be needed. But in her case, and most cases, oral supplements are very effective, and not the typical recommended iron, which is ferrous sulfate, which can cause stomach upset, constipation, diarrhea, nausea. I recommend an iron glycinate, which is more highly absorbed and gentle on the stomach. And I'll put that in the description below if you want to take a look. So I had her take 2 twice a day, which is about 120 milligrams of iron glycinate, plus other supplements she needed, and follow the free diet, which is a diet I came up with years ago when I was dealing with my own Hashimoto's autoimmune thyroid condition, rheumatoid arthritis, IBS, fatigue, and other health issues. I was able to get better, and since then helped many others. It's a diet that's free of not only gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. So since her iron deficiency was caused by her gut issues, which testing revealed she had gluten and other food sensitivities, leaky gut, bacteria and yeast overgrowth in her intestines, and very high inflammation. So she followed the diet along with the iron glycinate and other supplements that she needed based on her testing. She was deficient in not only iron, but zinc and other nutrients. So I had her do the, what I call functional 5, which is multi, fish oil, vitamin D with K, magnesium, probiotic, other gut supportive nutrients, the iron glycinate with vitamin C, zinc and other nutrients she was low in. She was soon feeling much better. And when we retested her at 4.5 months, her iron and saturation were at optimal levels. Her ferritin had improved. So that's another thing with iron. It is important to get retested. So she took a short break and then went to just 1 a day. And in the future, we will retest because you don't want to create iron overload, as too high iron can cause a lot of the same symptoms as iron deficiency. Other things that went to normal were her white blood count, neutrophils, and the markers of inflammation in her gut were much better. And the following symptoms were better: her fatigue, anxiety, dizziness, headaches, increased heart rate, abdominal pain, bloating, diarrhea, bloody stools. So she was doing great. And if you have any of the symptoms mentioned, it's important to get the proper testing first, because if you find out the root causes and have provided the right solutions, I believe almost anyone can get better. So thanks for joining me today. I'll put a video about the 7 causes of high ferritin and how to fix it here, the free diet phase 1 food chart below that we'd be happy to send you. Feel free to like and subscribe so more people can see this video, and I'll see you next time.